Yeah, of course, there are some key challenges, are we, most of us still probably still in the lizard hole, and we still, because we are trained, we are acculturated with Western psychology, like I did anyway, like everybody else does anyway, because there's no direct route to do Islamic psychology. There's no, or to become a counselor, there's no direct route. You have to do various things first anyway, Plus, whatever you do is not going to be recognized. If you work in the health service, they're not going to work as your certificate, from a particular organization. They might do if you work privately. The ethical issue, there's ethical dilemma in terms of giving advice, boundaries between because as a Islamic therapist, you have many roles, from being a companion, a friend, a Khalil, a Rafiq, a therapist, a teacher, or role model, and sometimes that can create difficulties, because I don't want to use the word transference and counter transfer, but that could happen, is that people might think they're friends, and then the boundary get problem. Of course, the most important thing on any therapy you do, doesn't matter what therapy you do, is the therapeutic audience, the trust. People would there's evidence to suggest that doesn't matter what therapy you do, if the therapeutic relationship is not positive, then it doesn't matter what therapy you do to make a difference. So in the therapeutic relationship, which probably is more important than the technique tools, because in human therapy, there's no technique, like others anyway. So now we have to decide whether you want to be directive, non-directive, or both, and you have to make a balance both anyway. Of course, recognize a clinical difference, Muslim kind. Not everybody is going to be acceptable. Not everybody's going to have the same type of iman. I'm maybe Muslim, but I'm not religious. So you have to deal with all these issues that, there are differences, clinical, but also you have differences in terms of, iman and so forth. But also you have difference in terms of how people present their illness. Cultural competence and ethical intelligence talk about, and ethical preparation. People have to be trained.